So hello to everyone and welcome to today's webinar, which will provide an introduction to the recently released report, Health of Canadians in a Changing Climate, Advancing Our Knowledge for Action. My name is Fiona Warren and I will be the moderator today. I'm the Knowledge Assessment Manager at Natural Resources Canada within the Climate Change Impacts and Adaptation Division, where we lead Canada's national assessment process. Claire Sanders at the Climate Risk Institute will be available during the webinar if you run into any audio or technical issues. To ask her a question, open the chat box using the drop-down arrow, locate Claire Sanders, and you can send her a private message. Please note that your microphones have been muted to avoid any audio distractions or feedback during the webinar. There will be a dedicated Q&A session during the webinar, but that doesn't mean you have to hold your questions until then. Please feel free to type out your questions during the presentation in the Q&A box located at the bottom of your screen. La présentation sera en anglais, mais c'est disponible dans les deux langues sur notre site web. Aussi, nous pourrons répondre aux questions en français par email après la présentation. We are recording the webinar today and we'll be sending out a link to everyone who is registered along with a copy of the presentation slides. As a virtual event, we are gathered today across the traditional and unceded territories of many Indigenous peoples. On behalf of those of us in the National Capital Region, I gratefully acknowledge that we are gathered on the traditional and unceded territory of the Algonquin and Anishinaabe Nation. I invite you to use the chat box to enter your own land acknowledgement from wherever you are today, if you wish. Today's webinar will focus on the Health of Canadians in a Changing Climate report, which was released last month by Health Canada as part of Canada's national assessment process. The results of this assessment will help inform further actions towards building climate resilient communities and health systems across Canada. Like all of the national assessment reports, it is available at our website, changingclimate.ca. We will begin today with a presentation by the two editors of the report, followed by a Q&A session. We will hear from them about the growing risks to Canadians from climate change related impacts, as well as vulnerability factors that increase risks for certain populations and communities. The presenters will also discuss promising adaptation measures that can support efforts to get ahead of the climate change curve and protect the health and well-being of all Canadians. So I'm very pleased today to welcome our speakers, Peter Barry and Rebecca Schnitter, who co-edited the report. Peter is a senior policy analyst and science advisor to the director of the Climate Change and Innovation Bureau at Health Canada. Since arriving at Health Canada in 1999, Peter has conducted research in several areas related to climate change, including health risks to Canadians, adaptive capacity, health system resilience, health vulnerability assessment, and communicating climate change risks to the public. He also serves as an adjunct assistant professor in the Faculty of Environment at the University of Waterloo, an adjunct research professor in the Department of Sociology and Anthropology at Carleton University. Welcome, Peter. Rebecca is a policy analyst at Health Canada's Climate Change and Innovation Bureau. Upon completing her Bachelor of Science in Geography from the University of Victoria, Rebecca obtained a master's degree in climate change from the University of Waterloo and is currently completing her PhD at the University of Alberta's School of Public Health. Rebecca is also a lead author on the chapters on health equity and food safety and security within the assessment report. So on behalf of everyone joining us today, I'd like to extend a warm welcome to Peter and Rebecca for presenting on the report today. It is much appreciated. So without further ado, I will now turn things over, I think, to Rebecca. Right, Peter? Should we start?
Yes, thank you.
Perfect. Thanks, Rebecca.
So good afternoon, everyone. Thanks for joining us today. And thank you to Fiona and Claire for the opportunity to make the presentation to the Adaptation Platform. The National Health Assessment process took 4 years, so it's really exciting to be here today and to be able to share the results of the assessment with such a broad range of partners and users. Our presentation will begin with some background information on the approach and the process of the National Health Assessment and an overview of some of the key findings of the report and specific key messages from each chapter. And then we'll end with some discussion on our communications materials, which may assist with some of your own work, and some findings that may be of particular relevance for partners and decision makers who work outside of the health sector as well. Next slide, please. So past reports on climate change and health have been published by Health Canada and the federal government, but previous assessments have not always been comprehensive. So in 2008, Health Canada published its first fully comprehensive climate change and health assessment. And in 2014, an update to that report was provided in the form of a single chapter on health in the report Canada in a Changing Climate. So as you can imagine, there's a lot of new research and information on the topic of climate change and health since the last report in 2008. And we've also seen quite an increase in demand for this information as the field grows. Next slide, please. So the National Health Assessment assesses the risks of climate change to the health of Canadians and to the healthcare system, and provides information on effective adaptation actions. We anticipate that the findings of the report will support actions by health decision makers at local, provincial, and territorial and national levels, as well as support those who are working in public health and healthcare fields. But also, as I mentioned, there is relevance for decision makers outside of the health system, and there are parts of the assessment that specifically address this. Next slide, please. So like Fiona mentioned, our report fits into the broader Canada in a Changing Climate assessment process that's being led by Natural Resources Canada. And it's one of a series of technical reports that's included in the larger assessment process. And I just wanted to highlight that Natural Resources Canada is leading the Regional Perspectives report, and that there are 4 remaining chapters from that report that will be published this spring and summer. And you can also see on the slide here, an assessment report on Indigenous resilience will also be published, and this is anticipated to be released in late 2022 or early 2023. Next slide. So the development of the National Health Assessment included public and stakeholder engagement, as well as collaboration with other government departments. For example, at the launch of the assessment, we conducted a number of stakeholder consultations to inform the approach, development, and content of the assessment report. And we've also worked very closely with Indigenous partners throughout the assessment process. And these engagement activities also really help to inform the development of our communication materials, which Peter will speak to in a little more detail later on in the presentation. Next slide, please. So the assessment was completed by a diverse author team, which includes over 80 leading experts in the climate change and health field from across Canada. These authors came from within and external to government. We were also privileged to work with Indigenous contributing authors for many of the chapters, and a team from the National Collaborating Centre for Indigenous Health also authored Chapter 2 on climate change impacts on the health of Indigenous peoples. The assessment went through a rigorous and extensive peer and public review process over the year 2019 and 2020, and that included over 70 Canadian and international expert peer reviewers, as well as a public review period through Natural Resources Canada's National Assessment Process website. Next slide, please. So this slide just provides an overview of the chapters in the report, and the table of contents is similar to assessments that we've done in the past. Next slide, please. But I just wanted to highlight some of the new information in a number of areas that are included in this assessment, and that will likely be very helpful for public health officials in their adaptation efforts, but also for sectors outside of the health system. So some of the new areas include new knowledge of health impacts on Indigenous peoples, as well as information on health adaptations. A chapter on health equity has been included for the first time in this assessment, and includes a framework to inform adaptation and greenhouse gas mitigation actions. There's a chapter on health system climate resilience, detailed examination of mental health impacts of climate change and needed adaptations. The report has 36 case studies of health adaptations, and 18 of these are examples of Indigenous-led adaptation case studies. And finally, for the first time, this assessment also included a discussion on health co-benefits and risks of greenhouse gas emissions. Next slide, please. So this assessment report has 9 headline statements, and in addition to that, each chapter has a series of key messages specific to their chapter. So the headline statements really pull out the main high-level themes and findings from the report, and I'll just go through those. So the assessment found that climate change is already negatively impacting the health of Canadians, and that those health risks will continue to increase as warming continues. Next slide, please. Some Canadians are affected more severely by climate change, as exposure and sensitivity to hazards and the ability to take protective measures varies across and within populations and communities. The report also found that climate change impacts on health systems in Canada are already being observed and will continue to increase in the absence of strong adaptation measures. So an example of this is damage to health facilities and disruptions to health services and operations from extreme weather events. Next slide, please. Efforts to prepare for climate change are known to reduce risk and protect health, and we must take action now to scale up our adaptation efforts in order to reduce current and future health impacts. The report also concluded that the health impacts of climate change on First Nations, Inuit, and Métis people are far-reaching, with disproportionate impacts on their communities, including food and water security and safety, air quality, infrastructure, personal safety, mental health and wellness, livelihoods, culture, and identity. Next slide, please. So in order to successfully protect all Canadians from the health impacts of climate change, decision makers must pursue adaptation actions that are inclusive and equitable and consider the needs of racialized, marginalized, and low-income populations. It also found that increased efforts to reduce greenhouse gas emissions are required to help protect the health of Canadians. Next slide. And finally, reducing greenhouse gas emissions can provide very large and immediate health co-benefits to Canadians. And the economic value of those health co-benefits can help to offset the costs of implementing those measures. Next slide. So we'll turn now to the individual chapters, and Peter and I will discuss some of the key findings of each of those. So for chapter 2, the Climate Change and Indigenous Peoples Health in Canada chapter reports that what many are already observing. So the health impacts of climate change on Indigenous peoples in Canada are already being observed and recorded and are far-reaching. Importantly, the chapter recognizes that First Nations, Inuit, and Métis peoples have been actively observing and adapting to changing environments in a diversity of ways since time immemorial, and that preparing for the health impacts of climate change requires that Indigenous peoples' rights and responsibilities over their lands, natural resources, and ways of life are respected, protected, and advanced through distinction-based Indigenous-led climate change adaptation, policy, and research. And the chapter provides some really excellent examples and case studies of Indigenous-led adaptation actions from across the country. Next slide, please. So the natural hazards chapter reviews in a really systematic way the latest evidence of current impacts on health and of future risks due to climate change related extreme weather events like heat events, severe storms, floods, wildfires, and droughts. And the chapter suggests that many decision makers within and outside of the health sector are not taking sufficient actions to prepare for these growing health risks, particularly for drought, storms, and heavy rainfall. However, it found that adaptation measures can be quite successful in protecting health. And the chapter provides, again, examples of adaptations, including some that have been shown to be quite effective, like early warning systems and greening living environments to cool them or reduce flood risks. And so now I'll just turn it over to Peter to walk us through the rest of the presentation.
Great, thanks so much, Rebecca. As Rebecca mentioned, the assessment had chapter on, next slide, please, on mental health impacts of climate change. This is, well, maybe I can kind of explain this as well. This is just a sort of a case study of co-benefits of greening communities. And Rebecca had mentioned about the applicability of some of the assessment results to other sectors. And so there are a few case studies throughout the assessment that really speak to some of the actions that other sectors can take to improve health. And this is one of them in the natural hazards chapter. And I'll speak to this a little bit more in some of the other slides. Next slide, please. So yeah, in terms of the mental health impacts of climate change, this is really a growing concern for a lot of health authorities. And the analysis really found that the current burden of mental health in Canada is actually likely to rise as a result of climate change. So, climate hazards can affect the mental health of people. Things like, floods, heat waves, wildfires, hurricanes, but also slow onset hazards like drought, sea level rise, and thawing permafrost. And really, there's disproportionate effects of mental health on specific populations. For example, Indigenous peoples with some of the very severe impacts that they're feeling. Women, children, youth, older adults, people living in low socioeconomic conditions, and so forth. But like the other hazards, we can actually adapt. We can be successful in adapting to protect health. And so access to mental health practitioners, healthcare facilities, social services, and culturally relevant mental health care is really, really important for helping to reduce or prevent some of these mental health effects from climate change. And next slide. So there's also a really robust analysis of air quality health impacts related to climate change in the assessment. And one of the key findings was that a warmer climate is expected to worsen air pollution in Canada, such as increasing ground level ozone layers in various parts of Canada, like Southern Ontario and Southwestern Quebec. And if we don't offset the air pollution emissions reductions in the future, air pollution health impacts in Canada, including premature death and disease, are expected to worsen in the future because of climate change. And so, one estimate was that we could expect 850 more deaths per year from air pollution by 2050 due to climate change if we don't reduce, air pollution emissions. But also there's a real focus as well on wildfires. This is increasing concern. And Canada really needs to prepare for a future with more wildfires. So this is one of the most significant climate change risks to air quality in Canada. But the chapter also found that mitigation measures, targeting climate pollutants, can really have important immediate and long-term local population health co-benefits. And I think Rebecca mentioned this in one of our sort of headline statements for the whole assessment. And one estimate found that reducing Canadian GHG emissions consistent with an RCP 6.0 pathway would actually result in an estimated 5,200 avoided deaths for a single summer in 2050. So really significant reductions in deaths if we undertake these kinds of GHG emissions reductions. Next slide. Another focus was on infectious diseases. Many people are quite aware of increased risk from infectious diseases. So many infectious diseases that are vector-borne, directly transmitted from human to human, zoonotic, and acquired from the environment by inhalation are really sensitive to weather and climate. So recent climate warming likely drove the emergence of Lyme disease in Canada. So it's actually been attributed, at least in part, to climate change. But like other areas, there are effective adaptations to protect Canadians. So things like model-based risk assessments, surveillance and early warning, which can be enhanced by emerging technologies in genomics and Earth observation. And certainly an integrated One Health approach is necessary for reducing risk to Canadians from infectious diseases related to climate change. Next slide. And certainly water quality, quantity, and security is really a significant, obviously, concern from climate change. And so, changes in precipitation temperature due to climate change they're already resulting in impacts to water quality and quantity and disrupting both natural and human water systems, and so increasing risk to health. And so some communities, smaller communities, may be more vulnerable to the impacts on water security from climate change because of water system infrastructure deficits. and perhaps fewer technological training and financial resources. But again, adaptation can really reduce health impacts in this area as well. And I think what's really important in this particular case is that you really need multi-sectoral collaboration in terms of adaptation to reduce risk to health. So coordination among public health practitioners and service providers, water and wastewater managers, emergency management officials, and even clinicians and researchers. Next slide. So this is actually a chapter that Rebecca led on food safety and security, and it reports that climate change impacts on food systems are increasing risk to food security and safety, both of which can really have important implications for human health. And so climate change is projected to exacerbate existing and create new food safety challenges in Canada. And it may actually increase exposure of Canadians to chemical contaminants. For example, persistent organic pollutants and heavy metals that can have harmful health effects. But again, adaptation actions that really focus on food system resiliency, and again, are multi-sectoral as well, can minimize risk to human health from climate change. So there's a lot that we can do to prepare food systems and to reduce risk to health from climate change. Next slide. And so, food security is a major risk to health because of climate change in many Indigenous communities. And the assessment actually, a number of chapters, and certainly the Indigenous chapter that Rebecca mentioned, there's a lot of case studies and examples of Indigenous-led adaptation. So this is one of them from this particular chapter on Indigenous food sovereignty as a climate change solution that may be of interest to people. Next slide. Another focus of the assessment was on health equity. This is one area that a number of health authorities and partners that were going to use the assessment really said, look, this is growing in importance. We need more information about this to adapt successfully to climate change. And so this became a separate chapter in the assessment. And again, this is another one that Rebecca led as well. And it reports that climate change can exacerbate existing health inequities among Canadians, which in turn can increase vulnerability to the health risks from climate change for some individuals and populations. And measures to adapt to the impacts of climate change or reduce greenhouse gas emissions can have quite large impacts on health equity. And they can either be positive impacts or negative impacts. And so it's really important for health decision makers, so those inside the health sector, but also those outside the health sector, to really pay attention to the effects, the possible effects that their actions, their climate change actions could have on equity within society. So designing and implementing effective actions to address climate change should ensure inclusive, equitable, and community-based participation in the planning processes. And this is really, really important because if we can support health equity as we undertake our actions to address climate change, we make Canadians more resilient. We make them healthier, more resilient to climate change impacts. And so that's really, really important and really what's needed. And we don't want to sort of detract from their resilience inadvertently by our actions. Next slide. And so, the chapter also provides some guidance for integrating equity considerations into the actions that we take. So, for example, actions to address climate change in the context of established health sector roles to improve health are the following. And I think a number of these are actually generic enough that other decision makers could use them as well. So when you're assessing and reporting on climate change impacts related to health, you want to collect data on the health impacts of climate change with an equity lens. For example, tracking deaths caused by extreme heat among racialized individuals in low-income communities, or mental health impacts among socially disadvantaged populations. As well, in terms of modifying or orienting GHG mitigation and adaptation activities to reduce health inequities, you want to assess climate change actions for their implications on health equity or even on equity in general before implementing them to minimize negative outcomes and maximize the positive benefits. And it's really important to partner and collaborate with others to build climate resilient communities, engaging in equitable, community-driven adaptation planning, or this becomes a much more difficult enterprise. And just generally, it's really important to participate and have broad participation in policy development related to climate change. Embed the health equity lens into all policy measures when you're moving forward. Next slide. And so, a next and final sort of focus of this assessment was on adaptation and on health system resilience. And this is actually quite new, looking at the health system impacts and the resilience of the systems. And one of the key findings is that the effects of climate change on health and on health systems in Canada are already evident, and they will increase in the absence of efforts to address existing vulnerabilities and close the health adaptation gap. There is a health adaptation gap in Canada. And so, Canadian health authorities are taking a range of measures to adapt to climate change, but they're lagging in the development of some concrete climate change and health actions. And so we really need to scale up these measures. So, things like training staff on climate change and health, undertaking climate change and health assessments at local, regional levels, developing emergency plans, and even dedicating resources to this issue. And, climate change impacts on health also pose economic costs to Canadians. And these costs are going to increase in the future also to health systems in the absence of effective adaptation. But again, we can be successful in protecting health from climate change. We've got more evidence of this internationally and within Canada that we can be effective. But we do need to scale up to protect individual Canadians, communities, and health systems in the future. Next slide. And so we heard loud and clear when we launched the assessment that we really needed to make sure that we communicate the findings in a very concise way that's accessible to a wide range of users. The full technical report is 768 pages, so it's a long report. And so we were very, very lucky to partner with the National Collaborating Centre for Indigenous Health and with ICLEI to develop some, I think, really great communications products. So the National Collaborating Centre developed some distinctions-based products. There's a really great fact sheet, sort of an overview in a concise fashion of the results from the assessment from that particular chapter that I think is really useful. And they've also done some webinars on Indigenous, I guess, risks from climate change, and also some graphic tweet cards that people can use to disseminate some of the findings. ICLEI, they also developed some infographics from each chapter and some tweet cards that anybody can use in their communications products that are based on findings from the assessment. So in presentations, in briefings, really in sort of anything, these can be downloaded and they can be used, and they've got key messages, key findings from all of these different chapters. And then our office developed a number of different fact sheets in some of the main issues of focus. So things like wildfires and climate change and health, extreme heat events, climate change and health. These are findings from the assessment. Health system resiliency, infectious diseases. I think there's 6 in total. But we also developed decision maker briefs based on the results. So these are 3 or 4 pages that are really targeted for specific decision makers that they can use to really get some of the key stats, key facts from the assessment, and also to learn a bit more about their respective roles in terms of climate change, adaptation and addressing this challenge. So we've got decision maker briefs for public health officials, for health system planners and administrators, for health sort of clinicians like doctors and nurses, and also for decision makers outside the health sector. And so that could be of particular interest for a number of people joining us today. Next slide. And so, really to be effective in protecting health from climate change in Canada, we really need to have decision makers within the health sector reach out and partner with those outside of the health sector. So, the sort of energy sector, water, infrastructure and built environment, agriculture, natural resources, transportation, urban and land use planning, social services. It's really important that we all adapt in a way that is protective of health, that we reduce greenhouse gas emissions, is protective of health, because these upstream determinants of health have a very significant impact, and it's going to be very difficult to ensure that Canadians are resilient to climate change if we're not taking this into consideration in all of our actions. And so this is really quite important. Next slide. So, sort of by way of a kind of an example, reducing greenhouse gas emissions, for example, in all sectors, again, can provide very large and immediate long-term health goal benefits to Canadians. So, by way of an example, GHG mitigation and climate change adaptation efforts that significantly reduce fossil fuel use also improve air quality by reducing fine particulate matter and other air pollutants, which can benefit health by reducing cardiovascular and respiratory diseases. And as well, increasing tree canopy cover and green spaces in communities can really help to reduce urban heat islands, and installing walking and bike paths can have multiple health benefits, such as reducing chronic diseases and even improving mental health. So these are very significant and can be very, very large positive health outcomes by just designing these kinds of activities in ways that that can be really beneficial to Canadians. Next slide. And this was a really interesting example, I thought, from the AIR chapter about some of the health co-benefits of actions to reduce greenhouse gas emissions. So this is a text box on the elimination of coal-fired power in Canada, a case study of air pollution health co-benefits. So it really looked at estimates of some of the health co-benefits of the Government of Canada. Reduction of carbon dioxide emissions from coal-fired generation of electricity regulations from 2012. And, these regulations, they really set CO2 emission performance standard for new coal-fired electricity generation units, but also for those reaching the end of their useful lifespan of 50 years. And it estimated that from 2015 to 2035, the improvements in air quality associated with these regulations would result in avoiding about 900 premature deaths, 800 hospital visits, 120,000 asthma episodes, and 2.7 million sort of episodes of breathing difficulty days. So again, really quite significant health benefits from these measures. Next slide. So, again, decision makers outside the health sector can play really a vital role in addressing climate change risk to health, implementing sector appropriate adaptation measures that integrate climate change and health information and considerations, and are developed in collaboration with health partners to ensure health equity is promoted and health co-benefits are maximized. Implementing sector appropriate mitigation measures to reduce GHGs and maximize health co-benefits, but also really importantly, implementing monitoring and evaluation programs to ensure that these actions are effective and address the needs of populations at highest risk, and making adjustments as necessary. The next slide. Just one other, I think, really interesting and really great example of this is the Standards Council of Canada, Health Canada, and the National Program for Playground Safety developed an annex to the Canadian Standard Association's Children's Play Spaces and Equipment Standard. And so this was really developed to provide guidance about how do you make these play spaces safer from climate hazards. So things like, making sure that you've got enough shade during hot days. Making sure that specific materials, that you don't have slides that are made out of steel or dark materials that really heat up and can harm children during some of these hot days. I mean, it's a really great example for me of mainstreaming climate change into existing activities that are going to continue, but also being really future focused, looking at the future hazards that climate change is going to bring, and really integrating those into current activities. So a really great example of cross-sectoral collaboration that really benefits the health of a population that can really be disproportionately impacted by climate change impacts. Next slide. And so, just a reminder that we do have that decision maker brief for people outside the health sector that highlights their roles in helping to address climate change impacts on health and collaborating with health sector officials. but also provide some of the key facts and stats from the assessment, from some of the results that Rebecca and I have shared that could be helpful for communicating this as an important issue to your partners. And then just the last slide, just in terms of how we're using this particular assessment, some of the results from the assessment with partners, using it to inform future science assessments of risk to the health sector and emergency management programs and policies. Really, it's great evidence-based information for development of specific health sector and emergency management programs and plans. Within Health Canada and the Public Health Agency on heat and air and water, policies and programs on food, infectious diseases, mental health, inputting into the national adaptation strategy that's being developed, the Climate Science 2050 plan. So we've been able to use some of the results for that, which has been great. But also providing information for local and regional climate change and health assessments. So Health Canada's Health Adapt program that's providing support to 10 health authorities at local and regional levels across Canada to do their own climate change and health assessments. And there are others that are undertaking these studies as well. We're hoping that this information benefits them. And then just broadly, building awareness of climate change and health issues among health sector partners and individual Canadians as well. So, helping with that communications function. It's a big challenge. How do you communicate the risks of climate change to Canadians and all that we can do to actually prepare for these impacts, because we really can be effective in protecting health from climate change. So we're really hoping that these results from the assessment can help these partners in that regard. So I think that's it. I just want to say thank you so much for the opportunity to Fiona, and hopefully this was of interest to all. Thank you.
There we go. Sorry, it took me a little while to get my camera back up, but thank you so much, Peter and Rebecca, for that excellent presentation. It's really amazing how much you accomplished on this. It represents such an incredible amount of work, which I know you and many other people put into it, and such a wealth of important information and findings and so many useful resources. It's really great to see the presentation today. So now we have about 15 to 20 minutes for questions, and thank you to those who have entered them during the presentation. We have some that we'll start with, and we have a few that were also provided in advance, but please continue to enter your questions. The best place to put them is in the Q&A box at the bottom of your screen. So I'm going to start with a question for Peter, a very specific question that came in regarding the statistic you said about the number of avoided deaths by 2050 under the RCP 6 emission scenario. The question was whether other emission scenarios were also considered in that study. So did they look at RCP 2.6 or 4.5?
I believe it was just RCP 6.0, but I would have to actually check back to see. I don't believe there were others that were looked at, but to be honest with you, I could be mistaken about that. But it is, the full sort of methodology is in the air chapter, and so I would invite people to have a look at that, because the air chapter did a really and the lead authors from the air program actually at Health Canada, I think did a really great job of having a look at and doing some analysis on what some of the benefits are from undertaking these measures. And I should mention too that in the Adaptation and Health System Resilience chapter, there is a figure, because the health system actually emits a lot of greenhouse gas emissions. And so that chapter does also look at, what are the benefits of taking these kinds of actions. And there's a figure that sort of lists some of the broad health co-benefits, related to air issues, but also other issues in terms of greening communities and whatnot, and some of the risks in terms of undertaking these measures. So that might be of interest as well to viewers.
Okay, thank you, Peter. So the next question is, could be for either Peter or Rebecca. It's pretty high level, but within the assessment, did you find that there were any positive impacts of climate change for health in Canada?
Rebecca, I can start that. So I think one area where it's interesting to look at sort of the positive versus negative effects is, and I think there's still some uncertainty about this, but looking at extreme temperatures, both heat and cold. And so, in Canada and in some other countries, cold actually does take a lot of lives, and causes morbidity as well. And so in the natural hazards chapter, there is some assessment of, comparing what we expect in terms of climate change impacts from more heat events, which, we're already seeing from, Canada's Changing Climate Report, but also a decrease in cold, because we're seeing a reduction in some of these cold events. And so, that's one area that I think we could see a reduction in some of the health impacts is cold. But interestingly enough, we did have a study done quite some time ago at Health Canada that actually suggested that if people stop adapting as much as they do to cold, because we're seeing less cold events, then that could actually pose risks, right? And so it could be it's a fairly complicated area, I think. But it is something, I think it's an important point that one needs to be looking at these areas as well. And then just maybe one last comment in terms of benefits. There's a huge benefit of climate change that the WHO, WHO calls climate change one of the biggest possible benefits if we adapt correctly and we reduce greenhouse gas emissions correctly. There are huge opportunities from climate change, and I think our assessment really underscored that. That depending on how we respond to climate change, there could be these really enormous health benefits for Canadians. Rebecca, I don't know if you have anything to add to that.
Yeah, thanks, Peter. And I think I was going to say the same thing. I think while not a direct benefit of climate change, but given that we will have to adapt to climate change, the opportunities to enhance health equity and strengthen social determinants of health simultaneously is a great benefit.
Great. Thanks very much to both of you. Now I'm going to move to a question for Rebecca, and this is one that came in advance of the presentation. So could impact assessment be considered as a viable planning tool to integrate sustainability and climate change consideration broadly across policy domains and sectors at the planning stage of proposed interventions? So could it be integrated into policies, legislation, programs, services, projects, etc.?
Yeah, thank you for the question. So yeah, from the health perspective, many local and regional health units are conducting climate change and health vulnerability and adaptation assessments, which are often the first step in protecting their communities from health impacts and adapting to future climate change. So the chapter on health equity provides some guidance on how to better center health equity into these assessments, which will then result in developing more robust assessments that support development of really tailored adaptation options for populations at higher risk. So for example, using tools like resilience and asset mapping, including health data and climate projections, and inclusive community engagement throughout the assessment process can really help with this. And when we talk about adaptation planning and the actual implementation of adaptation actions, it's also really important to assess how those outcomes of the adaptation measures will affect health equity in the community. And again, the chapter highlights why this is so important. So we do have evidence that indicates the outcomes of adaptation actions are not always experienced in the same way across populations and communities, and that existing inequities can create challenges and barriers to accessing and utilizing adaptation measures. So for example, air conditioning is an established adaptation measure to protect against health impacts of heat, but access to air conditioning is not universal. Low-income households, for example, may face financial barriers to purchasing an AC unit, or financial barriers to paying for the electricity that's required to run one. So in response to this, communities may establish cooling centers in community centers or other public spaces in order to provide access to AC for those who don't have it. But again, this isn't always accessible to those most in need. So for example, cooling centers could be or may not be on public transportation routes, or the cost of transportation to get to a cooling center might be prohibitive for the user. So all that to say, it's really important to consider the barriers to utilizing adaptation measures, but also to maximize the opportunities when planning adaptation measures. And then of course, monitoring and evaluating measures once they're put in place is also really important. And the chapter on health equity provides a couple examples of existing frameworks for assessing the impact of policies and programs on health equity, which will likely be really helpful for many adaptation decision makers, including those outside of the health sector. And as Peter mentioned in one of his slides, sectors outside of health have an influence on determinants of health and health equity. For example, transportation, energy, agriculture. So adaptation measures implemented in those sectors also have a great opportunity to assess their adaptation work and how that may impact equity as well. So again, just really highlighting the need and benefit of taking a multi-sectoral approach to adaptation. And maybe one last point on that, I was speaking with Peter this morning and he made the comment that health authorities will need to eventually give some thought to how their regular non-climate research and assessment activities, so things like impact assessments, can be either integrated with or the results used for climate change and health assessments. So I think that kind of really is getting at the root of this question. And so while there's not a lot of concrete examples of this happening in health or other sectors yet, I think some of the resources and examples in the report may help to enhance this in the future.
Okay, thank you, Rebecca. So there is, let me see, what question should we go to now? Well, there was one about COVID-19. Now, I think that you did manage to integrate some content within the assessment. I know the timing was a little bit tricky. The question was asking whether there's been any attribution of climate change to the pandemic, but I might broaden that a little bit to ask if there were any lessons learned from COVID that are applicable, or this, and maybe your thoughts even as health experts on climate change, if there's any linkages you see between the pandemic and climate change impacts and adaptation. Thanks.
Well, I know the infectious disease chapter, did look at, infectious diseases like that in terms of what some of the drivers are from climate change, sort of moving forward. A whole range, obviously, of vector-borne and those types of diseases. I guess in terms of lessons learned. Certainly COVID was a major strain and can be a major strain on the health system. And so, this assessment looked at the health system, and one of the key findings is climate change and the many hazards associated with climate change. The ones that we're concerned about from a health perspective, the floods and wildfires and extreme heat, infectious diseases. Mental health can have very significant pressures on the health system. They can really stress the system, and we know from the recent very, very extreme heat event that happened in BC just this past summer that one of the big challenges that they had was stress on the health system. Paramedics really feeling that added sort of stress from the heat event. And so certainly there's some, we didn't have any learnings in the assessment, didn't really have time for that. But I think, that's something that there could be learnings from moving forward. And I have heard from health authorities that one of the things that the pandemic did do is because of the experience with the impacts on this system. They sort of saw parallels, I think, in climate change, again, in the possible impacts on services and operations. And so, kind of maintain that interest in addressing climate change in the future.
Great, thanks, Peter. Rebecca, did you have anything you'd like to add to that question? No? Okay. We'll move on to the next question then. So this is another one about equity. So I think I'll probably direct it to you, Rebecca. It says, because health mandates largely sit with the provinces, has there been any consideration of how to boost participation of provinces to ensure equity across jurisdictions? I'm not totally sure whether that means across jurisdictions within the provinces or between provinces, but you can touch on either or what you feel most relevant. Yeah, I'm gonna end it there.
Yeah, thank you. And maybe I'll just start, and I'm sure Peter will have input on this as well, but perhaps just one example of this is our Health Adapt program, where we are funding local and regional health authorities. And so some of those are provincial and territorial partners that are conducting their own local vulnerability and adaptation assessments. And certainly in those, we have seen a lot of interest from our partners on the importance of centering health equity into the work that they're doing, and kind of learning from them as they conduct those projects. And also they're able to use some of the information that we provided in this assessment to help with those projects. So it's really been mutually beneficial for our office and our partners. But there are some examples of projects where they are really incorporating health equity into their VNAs. And so once those projects are done, the learnings and kind of best practices that come out of those, I think will be really relevant and helpful and applicable across the country. But maybe I'll just see if Peter has input.
Yeah, I guess maybe just one thing to highlight, Rebecca, is I think we're hoping that the health equity chapter, and also I didn't really spend too much time on it, but it was on that slide. There's a framework that Rebecca and others developed in that chapter that really shows the connections between drivers, sort of the big drivers of inequity in society. Really important determinants of health in terms of climate change impacts, but also the drivers of climate change vulnerability, and then how all of those relate to how we adapt and how we reduce greenhouse gas emissions. And the hope is that, for the first time, this is sort of mapped out in a figure. Some of these relationships are really made explicit so that health authorities across Canada at all levels can use this information and can be able to take more efforts to sort of look at health equity when they're adapting. Many are doing a lot of great things. And so, for some of those that can benefit from this information, it's there, and that can be used when they're undertaking health adaptation measures in the future, or whatever the case might be.
Thank you, Peter. No, I think a quick question for Rebecca. Did you take a focused look at the impact of climate change on immigrants and immigrant communities? Is there specific information within the report that you could point the participant to there?
I'm trying to think. This wasn't a main focus of the assessment. We did assess kind of the literature that was already existing, climate change impacts on Canada. So this is potentially, an area of emerging research, but I don't know, Peter, if you can think of if that was included. Nothing comes to mind.
Well, I think just, as you mentioned, that certainly in the literature that's highlighted that, newcomers to Canada can certainly be disproportionately impacted by climate change impacts. And I think that is highlighted in the assessment, and in fact, in I think a number of chapters based on some of the hazards that we've highlighted. So that message, I think, is really sort of in the assessment. But I think you're right, Rebecca, that we just don't have a lot of it's an important knowledge gap. in terms of what are those key drivers of, that really increase risk to that particular population. And perhaps even more importantly, what are the most effective adaptations, the most effective measures that can be taken to really help them, protect themselves and their families from climate change impacts. So it's certainly an area where we need more information, I think, and I think that came out in the assessment.
Just a quick question from me, actually. Did your chapters explicitly identify knowledge gaps and emerging issues? Yeah.
Yeah, they did. I think most of the substantive chapters at the end had lists of knowledge gaps. Yeah.
Perfect. So lots of ideas for future research and assessments. Okay, I think we have time for at least one more question. I'll switch to one that we received in advance. And I think this one is for Peter. So it's what data are available on the health co-benefits of greenhouse gas reduction actions taken in cities? How can we best convey to the public the health co-benefits of greenhouse gas reductions?
Well, so this is it's an important question because there's different kinds of information, right, that we have. That's available in the assessment, but also is coming out in the research in terms of, the broad types of measures that can have different kinds of health co-benefits. So example, things like I'd mentioned the case study on reducing, the use of coal as an energy source and, what that does to air quality. But, we have examples and more research about the greening of communities, and I think I may have already mentioned this, and that can improve mental health, and there are a whole host of different kinds of activities, and we're getting more research about what some of these health benefits are. In fact, Health Canada released, led by our colleague Gregory Richardson, a report for health professionals on the health benefits of reducing the urban heat island. And I think that was just last year. So it's a very, very similar thing, because a lot of those are health co-benefits actually of taking some of these actions. So we have information about this. I think where we get into issues is sometimes we're not able to quantify some of that information, in a specific context at the perhaps at a community level or a regional level. And this is where I think we do need more research. And so sometimes that's a bit of a challenge in terms of actually directing future policy or identifying an adaptation measure. But there are examples in the assessment. There is some quantification. I had highlighted some of that. That can be used for reaching out to partners, saying, look, this is really important, a really important area. We do have evidence that there can be really positive health co-benefits from undertaking these measures. And perhaps we need to, look together at how we can maximize those benefits moving forward.
Thank you, Peter. So we have 1 minute left. So I don't think we have time to do another question unless we have a really quick one. I don't think we do have time, but Peter, just flagging for you, there was a question to list the 10 health authorities who are conducting their own research, but maybe we could follow up with that after instead of asking you to list off.
Well,
here, or you can point them to where they could find that.
A quick way to do that would be to Google Health Adapt, because on the Health Canada website or the website, they're listed there. But I'm happy if anybody wants, and this is for any of these questions or anything in the future from the presentation, please contact Rebecca or I directly, and we're happy to send anything that's useful to you afterwards.
Great, that's perfect, because there were a few questions, a handful at least, that we didn't have time to get to today. So I'm going to wrap up now. So a big thank you to Peter and Rebecca for the excellent presentation and for answering all the questions. Thank you to the audience for joining us today and for your questions.